Hello all the viewers. In this video, we are going to discuss about what is hernia, what are the types of hernia, what happens if hernia is not treated at the right time, what are all the treatment options available for hernia, can hernia be treated through medicines or through any procedure, or does it require a mandatory surgery, and what are all the available options in surgery, what is the difference between an open hernia surgery and a laparoscopic hernia surgery. So let's dive into the topic. Let's start with what is hernia. Before that, we need to know what exactly is our anatomy. So let us focus on this part of the body, the abdomen. So as everyone knows, we do have multiple organs in the abdomen like liver, gallbladder, kidneys, pancreas, small intestine, large intestine, urinary bladder. In addition, females may have a uterus and ovaries all together. So these many organs are situated in the abdomen. So all these organs need to have some sort of protection, which is given by nothing but these muscles which are located over here. So to name these muscles are named as per the location. The muscles which are over the front region are referred to as rectus muscle. The red one which you are seeing is this one. This is nothing but the six pack which we commonly refer to as is nothing but the rectus abdominis. These are the muscles over the front portion of the abdomen. Whereas there are few other muscles in the lateral portion of the abdomen which are referred to as lateral abdominal muscles, and these are the lateral abdominal group of muscles. So what exactly is hernia is, if there is a breach or if there is a gap in the protection which is being offered by all these muscles, this is referred to as hernia. And as we can see, these muscles are covering the entire portion of the abdomen. Depending on the location of the hernia, these hernias are named accordingly. So many of the people do have a concern, especially when it comes to inguinal hernia, this hernia that happens in the groin. Many people do have a stigma to reveal it to their parents or to their family because they feel something that they have got a very rare disease kind of thing. But to speak on this frankly, many people, including neonates, have got this hernia. If the hernia happens in the region of navel in the childhood, that is referred to as umbilical hernia, and the same hernia can happen in childhood in inguinal region, which is referred to as inguinal hernia. And if you notice, these hernias can happen in any age group, right from neonate or from a small child to an elderly group. In all these age groups, these hernias are very common because the main root disease starts early in the childhood. Why exactly? What is the main initial event that happens in childhood that triggers to development of hernia is? Let's discuss about what all events that happen when the baby is in the mother's womb. To start with, when the baby is in the mother's womb, there won't be only one connection between the mother to the child, that is nothing but the umbilical cord. Through that umbilical cord, through this umbilical cord only, there will be all nutrient or blood supply transferred from the mother to the baby through a small opening in the umbilicus of the baby. So once the baby gets delivered, obviously the opening at the umbilicus, the muscles surrounding the umbilicus slowly approximate. So if the gap remains large, just after the childbirth, slowly this gap decreases and slowly it closes and closes. But still, even though it is closed, this area remains a potential site of weakness in the future. So what happens as the baby grows? There may be bit of traction or pressure over this weakened muscle, be it at the region of the umbilicus or be it at the region of the groin. So what happens as the baby grows, as age progresses, because of constant increase of intra-abdominal pressure, the small gap slowly may open up and thereby leading to a proper gap, then which is referred to as hernia later. Right? So Next, coming to the point, what are all the sites can this hernia can happen? If it happens at the region of umbilicus, it is referred to as umbilical hernia. If it happens in the region of groin, it is referred to as inguinal hernia. And apart from it, depending upon the location, there are few other types of hernia. For example, epigastric hernia means it happens way above the region of umbilicus, just below the breastbone. If it happens, that is referred to as epigastric hernia. And all the hernias that happen in the front portion of the abdomen all together are combined together as ventral hernia. If it happens at the umbilicus, it is referred to as umbilical hernia. If it happens in the region of groin, if it referred to as inguinal hernia. Apart from it, if it happens over the region where a scar has already happened, that is referred to as incisional hernia. This is mostly a sequelae following an open surgery, where what happens in open surgery, there will be a big incision giving over the skin, and the muscle will also be open to have access into the abdomen. So once after the open surgery, the muscles will be closed, but still even though the muscles are closed, there may be a potential weakness that develops in future, thereby leading to something called as incisional hernia.